Thank you guys for being here today. Let's do at least 10 nice questions. Let's read at least 10 questions. Oh, they are so important. They should be very high yield. Okay, let's start. Okay, let's discuss those 10 questions that I already answered. It's supposed to be like no answer questions. For the next video live, I'm gonna do no answer questions, so you can guys answer the questions just with me at the same time. We can do it together. You can make your comments in the comments below, and then pick your answers, and then we proceed to keep going. But in this case, the answer are already done. This is a video that already just answered the questions. So let's read the explanation real quick. This is good for when you're driving or something like that. You can hear what I'm reading, and then you can keep driving and things like that. So it's good for that. So that's the way I like it to do it. So just hold on, I'm coming back in a second. So this is a 30 years old man come to the office with 2 days of right arm pain and swelling and heaviness. The symptoms are worse with activity or arm elevation above the head and improved with rest. Okay, when he elevates his arm over the head, it get worse, and then when he gets some rest, it's only when he feel improvement. So the patient is and he like to lift weight and he like to play baseball. Several hours pre of the onset of the symptoms, he pitched 6 innings of the baseball game. So he has no prior medical condition and take no medication. The patient does not use tobacco, alcohol, or illicit drug. He does not use any alcohol, tobacco, or illicit drugs. Vital signs are normal. Examination show swelling and redness of the right arm from the elbow to the shoulder. Okay, so capillary refill is normal. Which is most likely cause of these patients' current symptoms? So the answer was here deep venous thrombosis. But in this case, in the upper extremity, deep venous thrombosis. This is something that we don't usually hear, because we all the time are used to hear like a deep venous thrombosis on their lower legs, on lower extremities. This is a little bit hard questions because everybody answered several different options, so 23, 24, 25, you see. So it's considered a hard question. So deep vein thrombosis is the answer. So they explain here upper extremity deep venous thrombosis are the risk factor are central venous catheters, repetitive arm motions like in the baseball pitching, on weightlifting, and malignancy. In this case, this guy have like a repetitive arm movement and a weightlifting like a risk factor. Manifestations are acute arm edema, heaviness, pain, erythema, dilated subcutaneous collateral vein in chest upper extremity, pulmonary embolism. That's a manifestation, sounds like it could happen. Pulmonary embolism. The diagnosis is with a Doppler and all Doppler ultrasonography, and treatment is 3 months of anticoagulation, and 3 months of anticoagulation. So in this case, we pick like a medial epicondylitis. So it's totally wrong answer is the D. Let's see why D is incorrect. So medial epicondylitis or golfer's elbow can sometimes occur in pictures. So we are a little bit correct, but now they wanted to pick this. They want us to pick deep venous thrombosis. That's why everybody almost picked this one. So medial epicondylitis, golfer's elbow, can sometimes occur in pictures, though it often results in arm pain. The pain is localized in the median elbow. This is like an intern part of the elbow, intern side. The pain is localized in the medial elbow. It would not cause arm edema and erythema from the elbow to the shoulder. Okay, that's the big difference. It would not cause that kind of edema. So why a lot of people pick this one, lymphedema? Let's see, lymphedema. Upper extremity lymphedema causes unilateral arm swelling, but most cases arise following surgical resection of an axillary lymph node. By example, lymph node dissection from the breast cancer. Lymphedema is usually chronic but acute. Okay. A lot of people pick this one, E too. So superficial thrombophlebitis is generally marked by localized pain and swelling along the plane of the vein. These patients with arms edema, heaviness, and pain that is worse when exercise is more likely has a DVT. So these young patients with acute right arm pain, swelling, and heaviness likely has an upper extremity deep venous thrombosis. That's exactly what they should put here, so the people don't get confused. Upper extremity deep venous thrombosis. That's the right answer they should put here. Upper extremity deep venous thrombosis, because a lot of people are gonna think this is on the legs. So this patient has upper extremity deep venous thrombosis. Deep venous thrombosis. The vast majority of the upper extremity deep venous thrombosis arise in the setting of central catheters, that when they have a central line on your subclavia. So, by example, peripherally insertion in central catheter. Okay. Otherwise, healthy patients can occasionally develop a spontaneous deep venous thrombosis. Spontaneous deep venous thrombosis due to the thoracic outlet abnormality that compress or injure the axillo-subclavian vein. Okay, and they're trying to express here this here. Okay, hold on. Young athletic men are at the greatest risk because most cases are linked to hypertrophic or scale subclavius muscle from weightlifting or damage of the vein from repetitive overhead arm motions. Okay, so in this case here, when they say thoracic outlet abnormality, they're talking about this here. So this is like a thoracic outlet abnormality. It is when you have an extra rib here, or a cervical rib. So this is the first rib here, and the second one and third one. So you have a one congenital malformation that you have an extra cervical rib. So this one is going to do compression over the brachial plexus here. You're going to feel numbness in your arm and numbness on your fingers. It depends on the amount of compression that this extra rib is doing on your brachial plexus. And as when the people do lifting, they develop those muscles here, like a posterior scalene and medial scalene and anterior scalene. So when those muscles get bigger, they do more compression here. And in this case, they're gonna do compression here on the subclavia too, on the subclavian vein, and then that's the case that you can have a venous thrombosis. This is in the case of the extra or abnormality, but you can have two, because too much movement on the arm, like a repetitive movement, they can give you a thrombosis too here in the area. That's what they're talking about. So the manifestation tend to arise in the domain of dominant arm within the hours of strenuous activity. By example, pitching a whole game, things like that. So patients usually have acute upper extremity swelling, heaviness, and pain. The pain often improves with rest and arm elevation to the level of the heart, because if you elevate over the heart, or like upper, it's going to be pain again, worse. So an elevation above the head typically worse symptoms. The diagnosis is generally made with a Doppler and a duplex ultrasonography. Okay, let's read the next question. So to learn, spontaneous upper extremity deep venous thrombosis most often occur in young athletic men with lift weighting or encouraged with activity that have repetitive overhead arm motion, by example pitching in baseball. It is marked by acute arm swelling, heaviness, and pain. The treatment generally requires thrombolytics, at least 3 months of anticoagulation. Okay, let's do the next question. This is a 63 years old man is brought to the emergency department due to the restlessness and altered mental status. His wife reported that he visions awake at 6 in the morning, agitated and slightly confused. Over the past 2 hours, his symptoms have worsened. He stated that he has feel well in the previous day, but went to the primary care doctor due to the persistent dry cough for 3 weeks ago. So following a upper respiratory tract infection. So he went to the doctor yesterday. He was okay. He now is slightly confused. He wake up in the morning. He's doing a lot of crazy stuff, and he's taking a new medication because the doctor give him something. The patient give him the doctor give him dextromethorphan and albuterol inhaler. He has history of major depressive disorder that is under control, and he's taking fluoxetine. Now he's taking 2 new medications. He's taking fluoxetine and he's taking dextromethorphan. So his blood pressure, vital signs are 160/90, and pulse 112, respiratory 22. So oxygen is 100% of your own air. It's excellent. He's now agitated, confused. The pupils are dilated, and the lungs are clear of occultation. All bilateral are okay. So hyperreflexia and ankle clonus are present. So he has an ankle clonus and hyperreflexia. Or neurologic examination. Okay, which of the following is the most appropriate initial therapy for this patient? So what should we give to this patient? We thought he was haloperidol, but no, this is only, let's see what is haloperidol 2. Haloperidol is an antipsychotic that treats psychosis and agitation. Should not be used in serotonin syndrome because this is a case of serotonin syndrome. Because this anti-epileptic property prevent the dissipation of the body heat. Okay. So in this case, this patient is having a serotonin syndrome. Serotonin syndrome. That's the happen with this patient. Serotonin syndrome. So the cause of this serotonin syndrome is the use of serotonin medications, especially in combination with another one. In this case, he using a serotonin medication, fluoxetine, and he combined it with the dextromethorphan. So, serotonin drug abuse or intentional overdose of serotoninergic medication or combination. Okay, so the clinical failures is mental status change, anxiety, agitation, delirium, autonomic dysregulation. In this case, the patients have diaphoretic, hypertension, tachycardia, hyperthermia, vomiting, diarrhea. Okay, neurological hyperactivity like a tremor, myoclonus, or hyperflexia. In this case, this patient have this. In this case, so the management is use benzodiazepine. That's the answer here. Lorazepam. That's what you should use. Without following is the most appropriate initial therapy in this patient. So benzodiazepine or lorazepam in this case. Okay. So this patient is taking a serotonin, selective serotonin inhibitor, has a high altered mental status. It has an altered mental status, autonomic irritability, and neuromuscular excitability. Okay, so it's a triad concerning for the serotonin syndrome. Okay, serotonin syndrome. When you have all that kind of stuff here, you have hyperthermia, hypertension, tachycardia, mydriasis, or muscular like hyperreflexia or ankle clonus. All that combination could be in the history taking some kind of medications like fluoxetine. You can suspect a serotonin syndrome. So this is typically followed by an increase in fluoxetine dose or serotonin syndrome can be also be precipitated by the concomitant use of another serotoninergic agent. These patients recently begin taking the antitussive, dextromethorphan. Okay. So the management of this is discontinuation on serotoninergic medication. Discontinuation of the serotoninergic medication. So management of severe hypertension with short-acting antihypertensive. Okay, como el esmolol. Okay, benzodiazepine, like el lorazepam, is an improved agitation. So decrease muscle contraction. Okay, that help. Okay, guys, this is it. I get tired. Just be sure to hit the like button and subscribe. Thank you very much, guys, for being here. Thank you very much, guys, today. Before leaving, let me do just a couple more things to learn. So just remember, serotonin syndrome is characterized by the mental status change, autonomic dysregulation, and neuromuscular excitability. The management includes discontinuation of serotoninergic medication, hydration, cooling, and blood pressure control. Benzodiazepines are used to decrease agitation and muscle contractions. Okay, good. So the next question is Bartholinic cyst. This is a very easy question. Bartholinic cyst. You can pause here and read the question. And the answer was about Bartholinic cyst. Bartholinic cyst. It's a relative easy question. You can pause the video and read the question, and the answer is placenta abruption. Nice picture. Guys, see you next time. Thank you.